Thank you, John. Just before I get started, I think we have to practice what we preach. So maybe everybody can stand up for just one moment because we've been sitting a long time. Big round of applause for everybody here, especially John and his family who've been leading this vision. Thank you for having us here. Thanks. Good. You guys can have a seat. Yeah. So Canada being the fittest nation on earth by 2030. What a vision that is. But how are we going to get there? Well, one of the really important components of getting there is going to be our children, both the children of today and the children of tomorrow. They're going to be an important part of making us achieve that vision of being the fittest nation on earth. So where are we at today? How do we measure up? How do our kids measure up? Well, a study from a few years ago of comparing Canada to about 30 other high-income countries showed we weren't the worst. We were in the top third, so that's pretty good. But when we looked at it, the grade that we got, it was a D+. A D+. So there's a lot of room for improvement there. And things haven't changed much. Participation, which people mentioned, they still release reports, and they had a report this year that looked at the physical activity levels of kids from 2023, and about 39% of kids met the physical activity recommendations in Canada, only 39%. So we have a lot of room for an opportunity for improvement here. And those recommendations are actually a little bit more than they are for adults. So not the 150 minutes a week. No, we demand more. It's an hour a day, plus 3 days of the week that are supposed to be bone strengthening ones. So why is it that we ask our kids to be more active? Is because it's even more important for them to be physically active. And I'm going to talk to you today about how active living helps reduce acute care and chronic health issues even in kids. And then I'll speak a little bit also about when it's important to intervene and some ideas of how. And we've already heard several ideas today, both from the minister and from within the audience. So I think that's great. So first of all, why is this so important for kids? Well, just like in adults, we know that physical activity has a positive impact on cardiovascular health in kids, improves blood pressure, lipid profile, and insulin sensitivity. And when we look at adults and we ask them if they were physically active when they were younger, we find that those adults who were physically active when they were younger, they have better blood pressure and better lipid profiles and all of those things. So we know that keeping physically active in youth helps to lay those healthy foundations for future cardiovascular health. But it's not only just future health, it's also current health. Type 2 diabetes. Type 2 diabetes, maybe 20 years ago when I was training to be a pediatrician, was very rare to see in children. In fact, it was something we call case reportable. And case reportable means it's so rare that if you have a patient that has that, you need to write it up and share with your colleagues and help to teach each other about these things. Unfortunately, today, it is all too common, and my pediatric endocrinology colleagues, they see several children with type 2 diabetes every week in their clinic. So being physically active can help reduce your risk of type 2 diabetes, not only for the future, but for kids today as well. Another impact beyond just the cardiovascular system is bone health. So this is probably even more important in kids than the cardiovascular piece. And the reason is we have something called peak bone mass. And peak bone mass, what that is that that is the strongest your bones are ever going to be. And so you reach peak bone mass, and it's different for everyone, and then it starts going down. And the rate of downhill is different for everybody. And for some people, if it goes down a lot, you can develop osteoporosis. So peak bone health is very important. And this, in females and in women, develops somewhere between 18 to 20 years of age. In boys, it's a little bit later, into their 20s. 18 to 20 years of age. that's your opportunity to reach the highest amount of peak bone mass. So doing activities like jumping, running, and other things that are going to promote bone strength, there's a key opportunity to do so as a young person. But it's not just physical things that physical activity helps with. It's also mental and cognitive. We heard a very personal story here just a moment ago. And in kids as well, we know that physical activity helps reduce symptoms of anxiety and depression, especially when that physical activity is happening in the outdoors. It has an even greater impact. Not only mental health, but also cognition. And cognition means things like memory, attention, and executive functioning. And so when kids are physically active, they are able to pay better attention. And we heard that was some of the discussions from earlier today. So for my patients, particularly those with learning and attention problems, I really encourage them to keep physically active because that is a way to help improve that cognition. So overall, kids who are physically active report better quality of life in multiple domains. So how do we do this? Well, one of the vehicles that's very important is organized sports. Organized sports can be team, like soccer, basketball, or individual, swimming, tennis, other things like that. And participating in organized sport helps promote physical activity and also helps develop discipline and social interactions, teamwork. There comes with it a sense of belonging and community. And it teaches children how to work towards common goals, how to handle successes and failures, and overall develop strong social networks. So participation in sports is really important. But one of the things we heard from Dr. Taunton and the minister speak of as well is that as children get older, their participation in organized sports goes down. And unfortunately for young girls and women, this rate of decrease is even faster. So girls start at a lower rate of participation in organized sports to start with, but they decrease even faster than their male counterparts. And this is because of different social pressures, lack of encouragement, and overall fewer opportunities. So this gets us to how we can intervene, how we can make a difference. One of those things are things we heard about already, and as the minister was promoting, was how do we encourage opportunities? How do we ensure that there is an inclusive environment? Lots of different sports. I loved hearing about those young girls and how they wanted to play basketball. So being open to doing it in different ways, I think, is one way that we can really be more inclusive. And if we can do that and increase both the participation of girls in a sport, that will improve our overall sort of physical activity levels and hopefully keep them involved as well. The other question is, when should we intervene? When should we be paying attention and encouraging kids to stay active? And the answer, of course, is as early as possible. So even for little newborns, their tummy time, that counts as their physical activity, right? You need your hour of tummy time a day. That's their hour to meet the guidelines. So they have to do it as well. But the earlier the better. And we know that when kids are young and active, they're more likely to be active teenagers. And if you enter adulthood as an active individual, you're more likely to stay an active individual through adulthood. So maintaining that physical activity throughout childhood and adolescence is critically important. And there's lots of different ways to do that. We talked about organized sport, but it's also an opportunity for families to do lots of physical activities together. We heard somebody talk about intergenerational activities, and that's been shown to make a really big difference. Some studies have shown that gender roles do have an impact as well. So for young boys, having an active father is going to promote them to be more physically active, and perhaps even more importantly, for young girls, having an active female or mother will also promote them to be more active. So these are a couple of different strategies that we can use to try to get kids to get active and stay active early on. Finally, Another strategy that's important that we shouldn't shy away from is risky play. So risky play, what does that mean? Well, risk is very different than hazardous play. So hazardous play is where somebody's doing something that's beyond their capability. But risky play is somewhere where an individual child can recognize and evaluate a challenge and then decide on the course of action that they're going to take. So it might be climbing a tree, it might be jumping off higher objects, and so on. And this helps them really understand their boundaries and look at different problem-solving initiatives. And this has been shown that by encouraging risky play, we actually increase the physical activity in kids. So it's an intervention that's been shown to actually have a positive impact. These are a few different strategies that we can use to help get kids to start being more active, but also equally importantly to stay active. And I think that if we want to reach that goal of being the fittest nation on earth in 2030, we're going to have to also pay a lot of attention to keeping children active. Thank you very much.